Typically, here at Travco, the goal is to start with therapy and then assess where the patient is at when it comes to their diagnosis, if medication is required. Typically, medication comes important when the diagnosis is starting to interfere with the different aspects of a person's life. For instance, like anxiety and depression. If a person is able to still function on a daily basis, like get to work, it's not interfering with relationships, friendships, education, just different spheres of one's life. Sometimes therapy is all someone needs to sort of process what's going on and work through varying emotions. But once that diagnosis starts to actually interfere with someone's life, like it's keeping them from going to work, going to school, having relationships, constant conflict at home, like someone wanting to just stay in bed all day or calling off work because they feel like they just can't do it, then medication's probably warranted to sort of make sure that the person can at least function. There are some diagnoses where medication is like first line, like for instance, psychotic disorders. That's something that is chronic and will last someone's entire life, and medicine is needed to manage that. Whereas other disorders like anxiety and depression, sometimes medicine's only needed for a short time, maybe like 6 months to a year, couple years. I always recommend going to see a provider in order to flesh out exactly what's going on. We're good at fitting them in as soon as possible, and we're very accommodating if there's a crisis going on or if there's issues.